Garmalgat ceann Carla. Bhuail mo bhuíochas a gabhfuil an mhuintir na hÉireann as an difríocht mhór a rinne siad chun dul le COVID-19. Tá an cúr a bhfuilú a going agus tá an chuid is measa den ráig thart. Tá na mílta daoine sa bhailte a going. Ní thabhraí obair an bhfoirne ospidéal agus lucht chúram sláinte orthu. Den nóin sin tá an iomarca cásanna nua a going agus tá an iomarca daoine ag fáil bás go fóil. Churn sin in úl doing go léithúil go bhfuil míad fósa géirí smacht ar chur ar an acíd. Mar seoldíomh tá plán a going chun an tíre oscailt ar bhealach adálaigh céim ar chéim. Tá 5 céim ann agus 3 seachtainna athrthú go léir ag tosnú ar an 8ú lá déag de bealtainna. Buinní sé tamama ach tuchaí ar saoil ar ais beagnach mar bhí ribhe seo ach beag go ná nua i gceist. Ba mi dábalta sólás crí a thuirt dá chéile go pásanta. Ba mi dábalta daoine a chur ais ag obair. Ba mi den ann a bheith buairtha brónach i deanta a chéile. Is í an teachtarach ismó atá agam. Tá gach duine atá ag fécant ná gur fiú na híbertí a rinne sibh. Tá na mílta daoine sa bhailte dá bharr. Is í an aim atá going inis ná an gníomh a thosaíomar a chur i gcrích. Ceann Comhairle, foremost in our minds are those who have lost loved ones because of COVID-19 and all who are suffering from its impact, physically, emotionally or financially. As of last night, 143 people have died since we last met in this format last week, and I offer my condolences and those of the House to their families and friends. Due to the decisions, choices and sacrifices of the Irish people, the curve has been flattened. It has plateaued, but our grief has not. We now have a roadmap for how we will bring our country to a new normal, and the stakes are too high to rush things now, or we risk everything we have achieved. As we start to ease the restrictions, we must continue our commitment to the basic actions such as cleaning hands and physical distancing. And we must try to find, isolate, test and care for every case and trace every contact. As we ease the restrictions, personal discipline around physical distancing and hand washing and respiratory hygiene will become more important than ever. As of yesterday, just under 215,000 tests have been carried out in Ireland. Over the past week, close to 62,000 tests were carried out, and of these, 2,280 were positive. That gives us a positivity rate of 3.7%, a rate which thankfully is continuing to trend downwards. 65,000 tests have been carried out in long-term care residential centres, including nursing homes, and 540 nursing homes, or 93% of the total, have been tested so far. This testing continues. During the course of this COVID emergency, nearly 3,000 people have been hospitalised, and 78% of those have made a full recovery. Some significant developments have taken place since this day last week. The HSE is increasing its testing capacity, which now stands at a capacity to test 12,000 people every day. And by mid-May, we're aiming to have a capacity for 15,000 tests per day. The total number of tests now done, as I mentioned earlier, is 215,000. That's 43,000 tests per million population. Depending on how you measure it, we're between 3rd and 7th in the European Union of 27, and we're now well ahead of countries that led the way previously in testing, such as Germany, South Korea and Singapore. But we need to focus also on turnaround times and rapid and aggressive tracing. One of our focuses from the very start was to build surge capacity in our hospitals. We needed to ensure that we had maximum possible number of critical care and regular hospital beds so we could cope with the predicted number of COVID cases requiring hospitalisation. We need to remember that the 3,000 people who have been hospitalised so far have come from all settings, some from their own homes, some from nursing homes, some from other forms of care home. They are young, they are middle-aged and they are older. The whole point of increasing critical care capacity and hospital capacity was because that's where the sickest will end up. 3,000 people have been hospitalised with COVID to date, and it's good that we haven't run into issues with the availability of critical care beds or ventilators. It could have been very different. The willingness of people in every village, town and city to follow the public health advice changed the future. It meant that our hospitals have been able to cope and our healthcare staff have not been overwhelmed. This success, however, has brought a different challenge, and we need to now work out how we can manage separately COVID and non-COVID care for a prolonged period of time. This isn't going to be easy. It means we need to provide care and services in new ways, like increased use of telemedicine and online clinics, increased use of hospital in the home, while ensuring that patients are confident about the quality of their treatment and reassured about the safety of the care they receive. For those feeling isolated, I know how easy it is to become anxious and lonely when you have to spend a considerable amount of time on your own, especially if you're a sociable person by nature. But please do remember that help is always available. Please reach out to a friend or family member and contact Community Call. We're waiting to hear from you. Ceann Comhairle, last Friday we published our reopening plan, and since then indicators are that we're going in the right direction in terms of the positivity rate. ICU occupancy is now down below 100, in fact falling towards 80 today, and we're increasingly confident, though it is not yet certain, that we can proceed with Phase 1 on Monday the 18th of May. Cabinet will make a final decision on that on Friday the 15th, following advice from NPHET. I know that we face some criticism that our plan to reopen the country is at a slower pace than other countries. It is true that it's slower than countries much less affected than us, like Australia and New Zealand, and slower than countries much worse affected than us, like Spain and Belgium. This is a decision the government made on foot of advice from NPHET, and it's one we stand over. I would rather have a plan that we accelerate if things go well, than one that we might have to pause or draw out or go back on if they don't. We're putting the lives of our people and their health first, and we don't want to have to reimpose restrictions like some other countries have had to do so. This would damage public morale and further dent economic confidence. We want to learn from the success and errors of other European countries reopening before us, and it is encouraging to see the data from Germany, which indicates that their reopening has not yet led to an increase in cases. I think this is a prudent, precautionary and health-led approach. The government is keen to hear from sectors and businesses who think they can open more quickly and see if there are plans for how they will achieve physical distancing and what precautions they will put in place to mitigate the risk where they cannot. Our objective is to help the country get through this emergency, rebuild our economy, get people back to work and keep them safe while doing so. We're currently working with business unions, the Health and Safety Authority and the HSE on the development of a return-to-work safety protocol to assist this. According to our most recent figures, 598,000 people are receiving the COVID-19 pandemic unemployment payment. This is on top of the 205,000 people on the live register. So a total of 803,000 people are now receiving some form of income protection from the state. As we know, we came back from the last economic crisis and we achieved full employment. I believe with the right policies we'll do so again, and with the right policies the recovery will be quicker this time. On Saturday we announced an economic plan worth up to €6.5 billion to help businesses impacted by COVID-19 and minimise the economic damage done by the pandemic. Commercial rates will be written off for 3 months. A €2 billion credit guarantee scheme will be introduced for small and medium-sized enterprises, and our Sovereign Wealth Fund, ISIF, has been mandated to invest €2 billion directly into bigger firms. Maintaining the link between employers and employees will enable a quicker recovery, and the wage subsidy scheme will help keep staff on the payroll. There's also a €1 billion COVID-19 funding package to help businesses with cash flow, and banks will also be able to dip into their rainy day capital reserves to keep lending flowing, freeing up €1 billion in bank capital to provide up to €13 billion in credit. Meanwhile, a suite of taxation measures will alleviate short-term liquidity difficulties. Ceann Comhairle, I'm keen to see a return to international air travel as soon as it is feasible and safe. There's a lot of work to do, but I am optimistic. I am more optimistic than others that air travel for business and leisure will resume this year. Currently, there's important work being done by the European Commission and various aviation safety agencies, and I hope to give an update on this to the Dáil in the weeks to come. Ceann Comhairle, we're still learning about this virus. It's noteworthy that initial reports suggest, from retrospective testing, that the virus was circulating in France as far back as December last year. That's before the virus even had a name or a test for it. In some ways, this is not surprising. France is well connected to China, with dozens of flights every day, and Ireland is well connected to France. Indeed, it is very possible that this virus was already in Ireland last year, or January this year, and we should not assume that it came here from Italy in late February, just because the first confirmed case did so. Further research and retrospective testing will give us a better idea, and time will tell. Ceann Comhairle, as we know, the coronavirus is the shared enemy of all humanity and all governments. And I believe the only way we can defeat a global threat is by working together on a multilateral basis. Working together, we can develop an effective vaccine, effective treatment and testing systems. So Ireland has contributed 60 million in direct or repurposed grants to the United Nations and has quadrupled our contribution to the World Health Organization. On Monday, on behalf of the Irish people, I pledged 18 million to Gavi, the Vaccine Alliance, so that the poorest and least developed countries in the world will have access to the vaccine if and when it is developed. And we're providing about 10 million over 3 years for immunology research. The Department is also supporting the WHO Solidarity Study, which is comparing 4 treatment options, including remdesivir, which is available to Irish patients under certain circumstances. By recruiting patients in several countries, and shortly here too, the trial aims to rapidly assess the impact of these treatments in slowing the disease or improving outcomes. As always, Ceann Comhairle, I look forward to hearing members' comments and observations.
Thank you, Deputy